Hi guys, and welcome back. In this video, we're going to talk about the anatomy of the stomach. So the stomach is the organ of digestion. It starts at the cardio-esophageal junction and ends at the pyloroduodenal junction. So from that, you can make out that the stomach has parts. They are actually four parts, and cardia and pylorus are two parts of the stomach. Now, what are the remaining parts? We have the fundus and the body. How can we know them? In the stomach, we have two notches. Cardiac notch, because it's at the cardiac end of the stomach, and we have the angular notch, and this is at the end of the stomach. So if you try to draw an imaginary line from that notch all the way to the greater curvature, that's gonna give you one part of the stomach, which is the fundus. And if you try to draw an imaginary line from the angular notch all the way to the greater curvature, that is going to demarcate the end of the body of the stomach and the start of the pylorus. So the parts of the stomach as are the cardia, the fundus, body, and pylorus. Now, the cardiac end, we call it cardia because this is related to your heart. However, the pylorus, we call it pylorus because pylorus in Latin means gatekeeper, and because you guys know that if we get the food here, we need to decide whether or not that chyme is ready to get processed to the duodenum. So we have an orifice, we have pyloric canal, and we have pyloric antrum. So antrum means entrance in Latin. Now this is the start of the pylorus. Pyloric canal is basically the second part, and the pylorus or the pyloric orifice is the area where it means this is the opening of the pylorus, and now we're going to get into the duodenum. Now back to the parts of the stomach. This is the body, this is the fundus, this is the cardia, and this as a whole is the pylorus. Now back to the stomach. The stomach is located in the left hypochondriac region and in the upper umbilical region. Now to remember the features of the stomach, remember that there is a rule of two. When you talk about the stomach, remember that we have two ends, like we just said. We have cardiac end and we have pyloric end. We have two borders, which is this and that. So what do we call this? It's basically a curvature. So we call it lesser curvature. And that is the greater curvature because it's a curve and it's bigger than the smaller one. And we have two surfaces, and the two surfaces of the stomach are, it's not a one surface, it's basically a combined surfaces. So we have anterior superior surface and we have posterior inferior surface. So just imagine that when you study about the stomach surfaces, try to imagine that there is a cute girl who's gonna slip on her back. So her body is facing anteriorly and up. So that is the one of the surfaces of the stomach. So it's anterosuperiorly. And her back is facing down, and that is making the other surface of the stomach, which is postero-inferiorly. And that is this is also called the gastric bed. So imagine that this lady is gonna lie on a bed, and the structures down related to the postero-inferior surface are going to be the same structures that make the gastric bed, and we're gonna talk about that down the road. We also have two notches. We have the cardiac notch and the angular notch. All right? So these are the external features of the stomach. Now, regarding the internal features, the stomach is formed of the mucosal layer, followed by the submucosa, and then the muscularis. And then if you look at this kind of wavy structure, this is what we call the rugae. So it's basically the highly folded mucosal lining because we need to accommodate the food and give enough surface area to digest the food. So it becomes highly folded when the stomach is empty, and it becomes distended if the stomach is filled with food. And we have here the gastric canal, and that makes the passage of the fluids faster, so they don't have to go through all these layers, folds of the stomach, because fluid does not need digestion as the food needs. So the gastric canal brings the fluid from the esophagus all the way faster to the pylorus and then to the duodenum. So moving on, the stomach has sphincter, and that is very important because we need to guard the chyme or the food that's in the stomach, and we want to prevent regurgitation of the food back during digestion. So we have two types of sphincters. We have physiological sphincter at the cardiac end, and we have anatomical sphincter at the pyloric end. What does physiological mean? It means I have stuff bringing the food from getting back to the esophagus, but this is not something structural. I cannot see a sphincter. I can see it's a wide space between the esophagus and the cardiac end of the stomach, but still the food cannot get back because there are other structures helping to keep this place closed and preventing the food from going backside. However, when we talk about the pyloric sphincter, it means we have a sphincter, and any sphincter would be formed of muscles, right? And these muscles should be contracted unless there is a hormone that relaxes these muscles, which is in this case thickening of the inner circular layer and some of the longitudinal layer of the pyloric part of the stomach. And unless there is a hormone that releases the sphincter, the food cannot get back. All right, so that is guarded anatomically by these muscles. Now, what about the physiological sphincter that we have at the cardiac end? Because you guys can see it's an open place and we don't have here thickening of the muscular walls. So that is because here in the cardiac end, we have an acute angle. So if you guys look at this angle at the cardiac notch, you will see that this angle is actually acute. So that basically kind of prevents the food. Like if you look at the stomach here, and if you look at the cardioesophageal junction, you will feel like once you eat the food, it gets in here and it becomes difficult to backflow to the cardioesophageal junction. That's because of the acute angle. Another thing is, if you guys look at the right cross of diaphragm, this is basically your diaphragm. You have right cross and you have left cross. The right cross winds around the cardioesophageal junction and the cardiac part of the stomach. It winds around it and it goes backward. So the muscle fibers of the diaphragm, when it goes around and with the breathing, with the contraction of the diaphragm, it kind of closes off this part of the stomach, and that brings us with the second part of the physiological sphincter that prevents the food from getting back. The other thing is the mucosa. It's very, very highly folded at the cardioesophageal junction. So if you guys look at the cardioesophageal junction, here this is the esophagus, here this is the cardiac end. So at the cardioesophageal junction, the mucosa is highly folded, and that is kind of giving an impression that there is a sphincter. There is a difficulty of the food to get back to the esophagus, although this is not considered to be an anatomical sphincter, it's a physiological one. Now, talking about the relations of the stomach, you guys remember the cutie girl that was sleeping? So just remember that you have antero-superior surface and you have posterior-inferior surface. Now, talking about the antero-superior surface of the stomach, if you just try to think about it, you will find out that the stomach is superiorly related to, if you guys look at this picture, you will find it's superiorly related to the esophagus and the left dome of diaphragm, of course, because our stomach lies on the left hypochondria region. It makes sense that the stomach is superiorly related to only the left dome of diaphragm, and definitely the esophagus, because esophagus is what brings the food to the stomach. So this is the superior relation. For the anterior relation, if you look at this picture and if you try to recall about the liver, you guys know that the stomach lies on the left side. So definitely what is anterior to that is the left lobe of liver, because your gallbladder is there. If you put everything back, you will know that to the anterior surface, the gallbladder is an anterior relation to it. And of course, the diaphragm is covering everything on the top. All right, so basically it covers, if your liver is basically here, then the diaphragm is covering everything up. So this is why the diaphragm is an anterior relation to the stomach. Moving on to the posterior inferior relations of the stomach, remember that the stomach has a bed. Remember the cutie girl that was flipping? All right, she was, slipping. All right, so remember that your stomach is having a bed, it lies on a bed, and that is an important concept in anatomy of the stomach, because you need to know the posterior inferior structures related to the stomach. So what are these? We have a spleen and the splenic artery going to it. So spleen, splenic artery. The stomach is on the left side, so it's going to be related to the left kidney and left suprarenal gland. Spleen, splenic artery, left kidney, left suprarenal gland. That's quite simple. There are other two important structures that you guys need to know that they are related to the stomach posteriorly. It's your pancreas, transverse colon, and the transverse mesocolon that connect them together and attaches them together. So we have three groups of structures related to the stomach posterior-inferiorly, plus the diaphragm, of course. Again, spleen and splenic artery, left kidney, left suprarenal, pancreas, transverse colon, and transverse mesocolon attaching them together, and of course the diaphragm. So coming to the blood supply of the stomach. So I decided to draw the pictures before recording to save some time, but we will go through them one by one. So when we talk about the arterial supply of the digestive system, you guys need to know that we have three important blood vessels coming out from the abdominal aorta, and these blood vessels are going to take care of everything down in the abdomen. I have the celiac trunk, so I have the celiac trunk, I have the superior mesenteric, and I have the inferior mesenteric. So the celiac trunk is the artery of foregut, the superior mesenteric is the artery of midgut, and the inferior mesenteric is the artery of hindgut, the derivatives of the foregut, midgut, and hindgut. And because the stomach is an organ that came from the foregut, so what's going to supply it is the celiac trunk. So starting with the celiac trunk, as you guys can see the yellow sun here that shows you guys the celiac trunk. The celiac trunk gives you three branches. It gives the left gastric, the splenic, and the common hepatic. So the celiac trunk gives only three branches: left gastric, splenic, that goes all the way to the spleen, and the common hepatic. Now moving on with these branches, the common hepatic, we call it common hepatic because it goes to the liver, so it's hepatic. But it's common because as it proceeds, it's going to give you a branch that is really going to go to the liver, and another branch which is going to take care of everything down, which is going to be the gastroduodenal artery. So the common hepatic will give you a real hepatic, which is the proper hepatic that goes to the liver up, and that is going to divide into right and left branches, and they are going to supply the liver. And from the right, you will get a branch to the gallbladder, and that we call it cystic, because the gallbladder lies on the right lobe of liver, so it takes a cystic artery. This is a branch of the right hepatic. So this is everything about the proper hepatic up. All right, and then because the common hepatic is a common artery, it's going to give the gastroduodenal artery. And why do we call it gastroduodenal? Because it gives gastric branch and duodenal branch. What is the gastric? It's the right gastroepiploic. All right, so forget about the duodenal branch. We're going to talk about that in the duodenum video, but just think about the gastric branches. So now I got only left gastric from the celiac, and that goes to part of the lesser curvature. And I got from the gastroduodenal right gastroepiploic that goes to the greater curvature. So in the naming of these arteries, we are going name based on the description of where are these blood vessels going. In the lesser curvature, we decided to give left and right gastric arteries. And this is a short name because it's going to the smaller place, which is the lesser curvature. However, when it came to the greater curvature, because it's greater and because we want to give a name that's different from the gastric, so we decided to add another part of a name, which is the epiploic, because those things are running in the epiploic means omental, it means something related to the greater omentum. All right, so these blood vessels, they run in the greater omentum. All right, and they are supplying here and there in the greater curvature. So these are going to be called the gastroepiploic or gastroomental. We have left and we have right. All right, from where we're gonna get these? So remember, the celiac was giving only left gastric, splenic, and common hepatic. That sounds great. So the left gastric is going to give the lesser curvature. All right, so I have left gastric, fine. I need now left gastroepiploic. Okay, what is the nearby blood vessel? It's only the splenic. I don't have any other option. So the splenic is going to give me the left gastroepiploic or gastroemental. I also have a fundus, which is far away from the body and everything else, and that needs blood supply. So thanks to the splenic, that's gonna give me the short gastric arteries. They're going to give blood supply to the fundus of the stomach. Now, what about the right gastric? Think about it. It's something related to the lesser curvature. It's up and it's on the right side. So who's going to give me the right gastric? It's the proper hepatic. So the right gastric is going to come from the proper hepatic, and they are going to do to form an anastomotic network between each others to supply the lesser curvature. The last one, we've already talked about it, which is the right gastroepiploic, which is a branch of the gastroduodenal. All right, that is the gastric part of the gastroduodenal. So the celiac gave me left gastric, splenic, proper hepatic. The splenic gave me the left gastroepiploic and short gastric to the fundus. And moving on with the common hepatic, it gave me proper hepatic up and gastroduodenal down. The gastroduodenal gave me gastric branch and duodenal branch. The gastric branch is the right gastroepiploic. So these two are going to be the blood supply of the greater curvature, and the left gastric and right gastric are going to be the blood supply of the lesser curvature. Now, regarding the venous drainage, it's quite simple and easy. Just think about the stomach as it lies here. Now, because the left gastric and the right gastric were coming from branches of the celiac trunk, directly from celiac trunk, all right, and of course, the right gastric was coming from the proper hepatic, but that was near to the celiac trunk. So think about the left gastric and right gastric veins. They drain directly in the portal vein because I don't have anything called celiac vein. So you think about it as the only thing that would resemble the celiac artery in terms of veins, it's going to be the portal vein. So right and left gastric veins, they are going to drain directly into the portal vein. Now, what about the greater and, the right and left gastroepiploic? Okay, so they were coming from down here and they are on the greater curvature. So what's nearer to them is the superior mesenteric vein. And yes, I have something called superior mesenteric vein. So they are going to drain into the superior mesenteric vein. And from there, of course, they need to go to the liver by the superior mesenteric vein union with the splenic vein. They are going to form the portal vein. So again, the right and left gastric veins, they will drain directly into the portal. However, the right and left gastroepiploic, they will drain into the superior mesenteric vein, and that is going to unite with the splenic vein behind the neck of pancreas to give the portal vein. So here, these were the left and right gastric veins. they are draining directly into the portal vein, and the right and left, so I have left and right, the gastroepiploic, they are going to drain into the superior mesenteric vein. Superior mesenteric vein, as it unites with the splenic vein behind the neck of pancreas, they are going to form the portal vein. Eventually, everything coming from the stomach is going to get processed to the liver so that we can take the nutrition, detoxification, and process the nutrients to the liver before it goes back to the heart. With that, we're done with the anatomy of the stomach video. I hope you guys enjoyed it. Thanks for watching. Don't forget to like and subscribe, and see you in the next concept.